All right, nice to have you on this beautiful Tuesday morning. It's hot, and we have to take off, you know, a little bit more extra clothing,
we
right?
still have summer here. We're still trying to get to the beach, have the bikini bod, but we need some help. We don't want to go through the work.
I don't want to do crunches, Dr. Paul Frank. No way. Dr. Paul Frank, by the way, is a fantastic cosmetic surgeon here in New York City, who is one of the only people who has this new machine out there, right?
What's it called again?
EMSculpt. So this is a groundbreaking technology. It's actually the first of its kind. It uses magnetic fields, much like you'd get in an MRI device. But what the magnetic fields do is that they hyper-stimulate the motor neuron. So you're getting contractions of the belly or the buttock in a way that you couldn't do with voluntary exercise.
So I wasn't really sure how I felt about it, but then I saw his Instagram picture, and I'm like, now I know Dr. Frank is in good shape, but when I saw the six-pack, yes. I was like...
No Photoshop there.
That's really, that is you.
No Photoshop, that's me.
So who is this really for? I mean, like, if you have, like, 20 pounds like I do, is it for me?
You don't have 20 pounds, first of all. But it's really, it's for that kind of hyper fit, thin, relatively good shape person who's looking for that extra edge, that last layer of fat, that little bit of extra definition, that little bit of extra lift in the buttock. So you have to kind of be in decent shape to begin with.
So how many treatments should you have
About
to
4.
get what you want?
4 is the standard protocol. It's been shown that we can increase muscle mass by 15% and burn 15% of fat. And then there's probably going to be maintenance treatments a few times a year after that.
All right, so I want you to show this. Todd, I want you to get close up on her stomach.
And this is Marissa.
Hi, Marissa.
Hi, Marissa.
So what's happening is the whole muscle is contracting. Unlike when you exercise where only part of the muscle is every 3 to 5 seconds, this is like 20,000 crunches in a 30-minute period.
And you can't always target specific areas, but this can.
No, this does the whole muscle group in a way you couldn't do on your own. So it's really hyper-stimulating the muscle, and that's why we get such a great response.
What's it feel like, Marissa?
Like an intense workout.
It does? Does it hurt?
Not at all.
No.
So are there any side effects?
You're sore afterwards. I tell people not to do crunches. You have to have patients who have no metal in their body or no hernias. This is a medical device. You think immediately you want this in your basement. It is like an MRI, so you have to be careful. It is a medical procedure.
You can overdo it.
You can absolutely overdo it. I've tried.
Really?
No, but you know, you really have to be careful and monitor the right patient for the right procedure.
And how does it do it on the butt? Because you said this is for like the stomach.
We have 2 paddles.
I'm very intrigued on the butt.
Yeah, that's for after hours. Yeah, you put them both on the buttock area, and it contracts it the exact same way.
So wait, all right. So you put it on your butt, and does it lift it?
It lifts
it.
It's stimulating the whole gluteal region, and it burns a little fat and lifts the buttock. That's one of the problems. Everything goes south as we get older. So this just kind of puts it right back up, much like exercise, except this gives you the lead that exercise can't do alone.
So you don't want to do squats after you have this done?
No, not right after. You know, but this is meant to be used in conjunction with diet and exercise. It would never be a replacement. But for that person who wants the extra edge, this is the only device that does it.
I mean, you can absolutely, if you watch this, Todd, if you get a close-up, every few seconds you just see like the muscles contract in the stomach, and it doesn't hurt at all.
Not at all.
And it will burn fat in the area. You're challenging the muscle in a certain way that it gets rid of the surrounding fat cells that have been developed over time.
And it can be long-term?
Yeah, but you know, like with everything else, you can't work out for 6 months and then never do it again. Most of my patients are coming in anywhere from, they'll come in once a year to once a month. For maintenance treatment. So it depends on the cost-benefit ratio.
Risks doing this? I mean, obviously you said you can't have metal in your body, but can you have a heart attack doing this?
No, but you don't want to do it if you have a pacemaker. Right. You don't want to do it if you have an untreated hernia. It's a relatively low-risk procedure, but it is a medical device, so you do have to be cautious. It needs to be done by a board-certified physician.
You know, when we hear about people having plastic surgery, a lot of times, if the person doesn't continue and maintain some type of exercise routine, fat will come in other spots that really are not attractive.
I mean,
can this happen with this as well?
Unlikely. Again, I'm picking the right candidates. I say life is a progressive disease. It takes maintenance.
Right.
So as long as you have the right patient who's watching what they're eating, they're committing to exercise, this is really the icing on the cake.
So you'll turn away some people.
A lot of people.
Really?
This is not a quick fix. It's not for weight loss. It's for the extra edge. And there are more than enough people who already take care of themselves that want a device like this. It just, they have to afford it and commit the time.
Yeah, well, how much is it?
It's $1,000 a treatment. It's sold in packages of 4 or 8. And each area, the abdomen and the belly, is the one we're treating right now. I think in the future we'll be having a lot of other areas in the body.
I was wondering,
like arms
and thighs.
Yeah.
Yes.
I mean, I honestly think this device is going to do for the body what Botox did for the face in the new millennium. It's really going to change the game in the way we look at body sculpting.
Well, see, you know, you on the cutting edge of all things. In fact, you and Madonna have this great skincare line.
That's right, Gdny Skin.
And you did this fun stuff on YouTube, the two of you.
Yeah.
And that stuff is kind of cutting edge as well, right?
That's right. I mean, that's why I need this. I have to keep up with her. It was not easy.
Has Madonna tried the EMSculpt?
I cannot say, but certainly there is not a patient in my life who is not strapping themselves to this
Really?
machine, so.
Well, you know, I'd like to try it. Can you do it over like clothes and stuff, or like?
You can, but you'd have to take off all your jewelry, and you're very fancy, you know.
She is very fancy.
And if you have like one of those bras with like the
metal strap, no.
No,
good.
no.
No good.
Okay, the
we'll get you on after.
Is there also like an age
No.
limit? I mean,
If you're old or young enough to want to be more fit and healthier, this is the right device. And again, a lot of my patients from nutritionists and trainers, those are the biggest referral sources because we could all only do so much on our own. You know, again, this isn't a replacement for anything.
So, Doc, how long should she be doing this?
She's on it for 30 minutes. 4 treatments over a 2-week period. It really has to be done stacked. And then maintenance treatments could happen. I mean, I have patients who come once a month. It really depends how much you want to get out of it.
Do you see a difference in what you've like? How many treatments have you had so far?
3.
Oh, 3.
You see some of the difference right away. It's like going to the gym. Right after the workout, you see that muscle contraction, but then there's a progressive increase as time goes on. It actually gives you an endorphin rush, this device. It makes you feel better about yourself.
do clothes fit differently?
Yes.
They do.
She's had the buttock also, so it definitely makes your clothes fit different.
Darn. I want to do that.
I know. We're going to get one for the studio, just for the studio.
Lori and I
Right
do a
before
lot
the
of sitting
show.
over there. You would see
During
us.
the meeting, we could get it done.
That's right.
So, okay, what else do we need to know? How long does it take something like this to come on the market? Because, you know, I understand, like, this has been talked about for a while.
It has. Now, it's official releases now. You're going to start seeing doctors across the country get it. You're not going to see this in the basement of your local gym. It's a medical device. It's an expensive device. It's basically a mini MRI. So this is not your quick fix med spa type procedure. But I think the growth of what we can do with it cosmetically and therapeutically is endless. We're going to start using it in other areas of the body, hopefully, different size hand pieces. So it's a big open space.
A physician has to be trained in it, in its use, right? Because you could do something
Absolutely.
wrong.
This is a medical device. So you're not going to find this in some nail salon or spa or something like that.
And if you do, stay away.
Please. Absolutely. Absolutely. Or my basement. You could find it in my basement.
Well, you know, thank you so much for bringing this
My
in and
pleasure.
sharing it with us. I wish Lori and I could test it out. But
We'll get you afterwards.
yeah, you know, aren't you intrigued slightly?
Yes, I'd love
Everybody
to
is.
use
You
it.
see this, and who does not want this?
I know.
Right, exactly. I love it.
Well, thanks for
All
having
right.
me.
Thank you. And say hello to Madonna for us.
I will.
Mike, what do you think of this?
I don't know. It could be a nice little addition
so
to
you know,
the whole thing.
Mike has very loose six-pack abs.
What?
You know that.
Easy now, easy now.
Is that such a thing?
It depends on when you catch
Well,
me.
because he did have them years ago. So
wow.
It's reminiscent.
Do I have to rip this off right here and now?
Because you know
I'm
he
gonna
will.
refrain. I'm gonna refrain.